Hi, Liberty family. Dr. Rebecca Cantu here to continue our conversations about stroke. Today, I will be speaking about a specific training method called dual task training. But before I continue with the conversation, I do want to make sure that everyone is aware that this information is meant to be for your knowledge. And if you have any questions specific to yourself, please make sure that you are contacting your PCP before implementing any kind of techniques. Okay, so after suffering a stroke, time is crucial in conducting the correct procedures and for your ability to achieve the most gain in your return to movement. Studies in regards to treatment for stroke have shown that dual task training technique has been very beneficial for the continued gain and recovery for motor tasks, especially for things like walking, which tends to be a difficult action to return to after certain kinds of strokes. Dual task training is the technique of using two specific tasks. So whether it be something that is a cognitive task, so for example, like counting down or reciting a poem, or like opening up a package or pouring a cup of water into another container. Again, these are the two different types of tasks that can be conducted for dual task training. And again, these are often accompanied with another kind of task. So for example, like walking and then being able to do things like reciting numbers backwards, or again, like pouring a cup of water into another container. So again, dual task training has been shown to be important when, again, adding to one's neuroplasticity, which is, again, the overall gain of new pathways to achieve, again, improvement in your motor tasks. In most recent studies, and again in reference to reports discussed by a leading neurotherapist, Dr. Mike Studer, dual task training should be executed with tasks that are relevant and specific to the patient. Tasks should be achievable by the patient and in an environment that they are able to complete the tasks. So for example, if someone who has suffered a stroke is not yet able to manipulate with something with their hands, and they're having difficulty with walking or traversing on a flat pathway, then it might not be useful or might not be the most successful to ask them to, again, like try to pour a cup of water into another container while they're walking on an unsteady surface like grass. But again, this technique is an important part of recovery, as oftentimes being able to do multiple tasks at one time is a part of gaining one's prior level of function, and also is more beneficial to allow somebody to return to the community more safely. Therefore, seeking a PT clinic or a PT that is able to tailor a dual task treatment that is specific to one's goals is important, again, for their overall recovery. And I will be sharing some examples of that with you at the end of this video. So thanks for listening, and of course, move well, feel well, and be well. Thanks.
Go.